This asks for your members of Congress to sign a letter requesting that Medicare cover medically necessary oral and dental care covers a lot of bases. It benefits cardiothoracic surgeons, it benefits patients, and it benefits other specialty societies. The Society of Thoracic Surgeons is one of 72 organizations listed here that make up the Oral Health Initiative, which was formed to support Medicare coverage for medically necessary oral and dental health therapies. Oral health is inextricably linked to the rest of the body. It is well established that chronic diseases disproportionately impact Medicare beneficiaries and impose a substantial cost on the federal government. It is also well established that untreated oral microbial infections are closely linked to a wide range of costly chronic conditions, including diabetes, heart disease, dementia, and stroke. In addition, oral diseases have been documented by researchers and medical specialty societies as precluding, delaying, and even jeopardizing medical treatments such as organ and stem cell transplantation, heart valve repair or replacement, cancer chemotherapies, placement of orthopedic prostheses, and management of autoimmune diseases. Most Medicare beneficiaries do not currently receive dental care, even when necessary for the treatment of Medicare-covered diseases. There is no medical justification for this exclusion, especially in light of agreement among physicians that this care is integral to the management of many diseases and medical conditions. The lack of affordable, medically necessary dental care increases the risk of costly medical complications. These complications increase the financial burden on Medicare, patients, and ultimately taxpayers. If Medicare covered medically necessary dental care, it would improve outcomes associated with many diseases and medical procedures, including cardiovascular disease, vascular grafts and recurrent pulmonary infections, orthopedic prostheses, solid organ and stem cell transplants, and certain cancers and autoimmune diseases such as multiple sclerosis, lupus, and rheumatoid arthritis. No new legislation is needed to cover medically necessary dental care. CMS has the authority under the statute to cover dental care that is incident and integral to urgent, life-saving medical treatments. In fact, while the cost of covering medically necessary dental care would cost $7 billion over 10 years, it would ultimately achieve a net savings of $63.5 billion over that same time span. This is because treating urgent dental conditions will prevent other, more complex issues down the road. This has been demonstrated as insurance companies have achieved significant medical savings by providing coverage for the treatment of periodontal disease for individuals with heart disease and diabetes. At least 6 major insurance carriers offering dental plans provide enhanced periodontal and preventive coverage to targeted enrollees with conditions such as diabetes, heart disease, stroke, head and neck cancers, and transplants. Such coverage has realized important benefits, including markedly lower hospitalization and emergency department admission rates, as well as substantial cost reductions. Medically necessary oral and dental health care, including periodontal treatment, should be provided in traditional Medicare as well. Please ask your elected officials to sign on to a letter from Congress to CMS, which urges CMS to use existing statutory authority to make coverage available in traditional Medicare that would improve clinical outcomes and reduce costs for beneficiaries needing medically necessary oral and dental care. This letter will be included in your folders that you will bring to the Hill.